male dog who is presented to us, and he has got a traumatic accident. I mean, in which he got his legs cut uh, by some unknown source, maybe some trauma, or maybe a real accident, or the history is unknown. And this is an abandoned dog, so the rescuers, brought this to me, and today I'm going to do limb amputation. So this is the infected part. We have cleaned everything, and then we have surgically, made the site ready for performing the procedure. And so always when you're going to amputate a leg, it's highly recommended that you should remove from the joints and not from the shaft. So I have seen many surgeons who are actually, you know while amputation, they just cut from the mid shaft, and they just suture it. So it should not be like that. You always have to cut the joint from cut the leg, or perform the amputation from the joint. So I'm going to remove this tibia, and let's see how things goes. I'm going to give a linear incision, a curvy linear type of incision, uh, at the level of tibial tuberosity first, and so it will be more like this, and then I have so this switching is uh, because of the electrocautery, and not because this dog is awake. Okay, so okay. इसको और प्रोपोफॉल देना पड़ेगा, इसको वो बंद हो गया, प्रोपोफॉल देना पड़ेगा इसको, और बीपी डाउन हो रहा है, इसकी बॉटल तेज कर, और एनेस्थीसिया थोड़ा लेस करो उसको. Okay, so now can I have scissors, please? Scissor. Okay, so I will now try to cut through the fascia first. So I'll separate the fascia from this part, and a part of some distal flexors muscles also will be cut. So I can do like this. I can just perform the cautery, and there's a vein going on, so I have to be careful to first ligate and then cut. So here's our vein, and so this is a small vein. So what I can do is I can just ligate this with the help of electrocautery over here. it is done. Now these are the, so this one is probably a tibialis cranialis, and these are some flexors, distal flexus muscles. So okay, good. So now I'll ask my, I'll first continue with the incision over here. Great. And will continue my incision like this. ऐसे पकड़ना, ऐसे, हाँ इससे मत पकड़ना, निकल जाएगा ये। बेटा वो उसको सेट करो जरा, चलो पास करना है इसको, डॉग को पास करना है इसे, बस। वो कहाँ गया, फोर्स वैसे पकड़ना पास में। So can I have one more 209 क्वार्टर ड्रिप, 1 क्वार्टर ड्रिप। ये सरक गया नीचे, ये देखो बेटा सरक रहा है, इसको पकड़ो अच्छे से, तुम इसको बस पकड़ के रखो। ये है हमारे पास एक, हड्डी की तरफ से पकड़ना, हाथ छोड़ो मेरा, और यहाँ से पकड़ना, हड्डी से, यहाँ से नहीं पकड़ना, ये भी गिर जाएगा। हड्डी से ही पकड़ना यहाँ से। बॉटल तेज करो सबसे पहले, और बीपी थोड़ा कम कर दो। So this dog has lowering of BP with a good sinus rhythm. So we'll first increase the fluid and lower the anesthesia, gas anesthesia. So I'll ligate this muscle, this vessels from here. Okay. So now, I will cut through the ligament, and here you can see I'm now opening through my stifle joint, cutting through my stifle joint and extending this incision Okay, good. I will continue the same over here. So we have almost, you know, cut through. So पकड़ के रखना. Our joint. I'm now going to cut the ACL and CCL. Okay. And okay. I might be missing some vessel. For that I'm putting this right angle forcep over here, and will give blood supply here. Now I'll have to cultivate muscle flap. For that I will first there's a bleeding from the other side, and for that I'll put a wash piece inside and will continue my incision from here. So I'll take this gastrocnemic muscle to use as a flap. For that I'll go inside and I will separate the gastrocnemic muscle along with some digital flexors as well. So I will now dissect through this muscle and will cut the remaining part of gastrocnemic muscle like this. बेटा वो पूरा आउट ऑफ फोकस हो रहा है, क्या देख रहे हो? Okay, so I'll have this flap, this muscle left intact, and I will just cut through here. And this dog is not, I've not blocked this dog, and it is highly recommended that you should give a, sciatic and a femoral nerve block, which we have not done. So otherwise, this kind of uh, twitching while the section will not be within. Okay, so this is it. Now I'm going to cut, and here I'm cutting through the meniscus and here, while giving a cut, we should be very much you know careful, because the major arterial line that is supplying through the lower limb is going all the way from here. So what I will do is I will take artery forcep and will first clamp this up, and then we'll ligate it. So see, you can see the blood is oozing out from the cut part, and okay. Right. So now we'll मुझे वो देना bupivacaine and lidocaine. I'll have to block the nerves here first, and will then uh, इसमें वो कितना मिला है, कितना कितना क्या क्या मिला. फोकस देखना, फोकस में है कि बाहर है. Okay. Okay, so now I'll cut through this portion of muscle from here, that is great, and we'll cut. Okay, so इसका अलग रख लो. So थोड़ा सा ऐसे करना, and I will separate okay, so इसको अलग करो. So right. So now we have this portion to ligate, and then followed by a muscle flap. I'll also okay, wait. So can I have 20 polyamide, please? मेरा फोकस से आउट ऑफ फोकस चला जाएगा, देखना. 20 देना. So I'll go like this. and again come up like this, and oops, so we have to redo it again. So I'll go from here, and I'll again go from here. Hmm. इसको हटाना, पैर पकड़ो, हाथ से पैर पकड़ लो, बस स्लिप ना हो। देखो फोकस से है कि बाहर चला गया। तुम उधर खड़े हो जाओ उस पर। Okay, so this is how we have, ligated the artery, and now we'll remove this clamp to see if there's any bleeding coming up. So no bleeding from this side, and then at this branch also we don't have any bleeder. Okay, so now this portion of muscle will act as a flap for to cover the distal portion of बेटा ये बाहर चले जा रहा है, फोकस में से रखो उसको। वो कहाँ गया? थंब फोर्सेप्स चाहिए मुझे, मैं निकालूं? इधर तो नहीं रखा है, नीचे गिर गया था, नया दे दो। So I'll take a bite here, and we'll go deep bite here, and then again I'll go through a bite here, and we'll take a deep bite here, and then again one more bite all the way, and take a deep bite from here, and then इसको हटा लो, पैर पकड़े रहना। So now I'm going to, so this is how we make a good bed, muscle bed for this end of femur. And then I'll join this again, and then okay. So now everything is done. Our muscular flap is done. Have to see whether we can reduce this. Yes, so we can very well reduce, ऐसे पकड़ कर रखना, कुछ मत करो, ऐसे पकड़ कर reduce the skin. I'll cut through this extra portion of uh, okay, and now I'll inject my remaining ये हो गया फोकस में है so mm, right. Okay, so now I will start suturing the uh, the lower portion of the muscle and there is a capillary bleeding coming up, but I'm not so worried about it because once you suture them, everything will be stopped. So can I have one more 20, please? Okay, so this is it. Now I'm going to do some 20, please. 20 दो मुझे 20 polyamide. I'm going to do some एक नया मुझे मॉपर दे दो एक नया मॉपर okay so now suturing through sub-Q and skin. Hmm. Okay, so Krishna. Great. So now we have there was okay. थोड़ा सा इसका वो सीधा कर लेना और देखो फोकस में है कि नहीं. Okay, so we have, you know, closed the subtube, and now I will go for closure of skin. So if you guys can able to see, we have, you know, done limb amputation, and we'll give some more subcutaneous and skin sutures. So this is it for the surgery. So always and always when you are amputating a leg, you should have to amputate that from the uh, joint and not from the shaft. So this is how we can, you know, amputate a leg and can save, the patient from a lot of post-op complications that is coming uh, because uh, because the bone is not, removed from the joint, and it was cut, mid shaft. So this is it for the surgery. Thanks for watching, and we'll try to live stream some more cases of surgery whenever I receive them. So yeah, please take care of yourselves and have a great day ahead. See you guys soon. Bye.